Welcome to the News 5 conversation on safely back to school. So glad that Dr. Joan Zoltankski has decided to hang around with us this morning and really dig into this because, Dr. Joan, we know that there's been a lot of change in our country, which has produced a lot of change in our schools. But I just want to ask you, again, I think the mask with little kids, how can parents, convince their little kids to, they got to keep this mask on for most of the school day? That's pretty tough.
Mm-hmm. So there's a few things that we think about. And as I mentioned earlier with you, we do this in our hospital now that when children come in and they're over 2, they mask. And so we really engage the family. The family is very important in setting this as normal. I know masks have become political, but we consider them medical. And so when we talk with children, we also talk with their family and their parents. And so a couple of things that they can do is, as you have done, to start wearing them now, to make it normal now. And also is to try on different types of masks. I have now at this point, I've always worn a mask intermittently at work, but now I'm wearing that at home. And so I wear the cloth mask around in the community when I go out. And I have probably about 10 different types of masks. And there's 2 that are my go-to masks all the time. They have thicker straps behind the ears, so I like that. But I wear one, and if I'm out about all day, because for work sometimes I'm out in the community all day, I switch halfway in between. So about noon or so, I switch the mask, and it's a little more comfortable in my ears and comfortable on my face. So we talk about having a mask, but also having a backup mask. So if a child really feels uncomfortable with that one type of mask, if they're really tugging at it and having challenges, try putting on the other mask. And sometimes that's just a relief to get that different mask on.
And one thing that I have incorporated is trying to use a fun mask. Have the child pick out masks that, they think looks kind of cute, maybe their favorite cartoon character or something like that. Do you think that could maybe help, maybe get them more involved in the process of mask wearing?
Yes, we've seen a lot of really good bling on masks, and so children decorating them themselves, and some sparkles and all of those types of things. So yes, finding a great comfortable mask and allowing them to decorate it themselves is a great idea, Danita.
Well, we are on Facebook Live, also on our YouTube channel. So we want to encourage all of you who are listening in, if you have questions or comments, something that you would like for us to dig into this morning for you, because we know it's a lot of information out there that is coming at us sometimes at all sides. This is your time to get your questions answered this morning. You said something key a few minutes ago. You pointed out 4 things that we need to pay attention to, that parents need to be aware of.
So this is one of the things in our healthcare system that has really stood the test of time. And that says a lot in COVID, because not much stands the test of time. But there's so much out there. There's the CDC and the American Academy of Pediatrics and the Department of Health and what your pediatrician is saying, and. And the way that we think about it, that I think about it, is there are really 4 safety measures that everything kind of falls under these 4 safety measures. There's the masking, there's the distancing, there's the symptom checking before you leave the house, before you go to school, and then there's the cleaning. And so we can talk about that a little more, but for me personally, as an individual, that cleaning is around hand hygiene. For a school, that's something different. That's the deep cleaning, that's using the EPA cleaners and those types of things. Oh, there's our graphic there. But so we talk about these. We tried to put them in the ABCDs for schools in a way to remember them. But this is that always masking. Be aware of your symptoms. So before you go to school, before you send your child to school, or the older children before they leave for school, to check their symptoms and their temperature, to clean their hands, and at school, your physical space, your desk, those types of things. And then the distancing. So of course, for children, we want them to distance physically and not socially. We want them to stay connected with their friends, with their teachers, with their community, but to understand the importance of that physical distancing and slowing the spread.
Doctor, the concern that I know that I have as a parent, I'm a little concerned about, I know my child will wear the mask because I've conditioned him to wear a mask, but I'm a little concerned about the classroom and the social distancing aspect. And it is hard to keep young kids away, from each other. I would imagine that's a challenge for schools.
Yes, it certainly is. And we've seen and worked with a number of school systems and schools, and we have seen some very thoughtful plans around the distancing. We haven't seen any school that's saying, just come back in and everything's going to be the same. They're setting up desks, and what they're doing, which is important, is they're trying to set up the culture of distancing. And this is what we've talked with them about. So not bring them in and be the enforcer, but actually get rid of the desk. So don't leave the desk and say, don't sit there, but get rid of the desks and space out the desk and space out the chairs. And also something that we like, which is not every school can do, but if your school can, what can be done outside? Can you have class outside? Can you eat outside? So the more outside is better, but we know it's hot. And then of course we can't do that in December,
No, we
but
can't.
as much as you can using that outdoor space.
Well, we do have a question. Joyce Perrier, who's on our Facebook Live, she's saying, are children the possible spreaders of COVID-19 now through hugs, giving hugs?
Well, so certainly there's not a study on hugs, but we do know that children can spread COVID. And so that's why we worry about it. And that's why we talk about all of these parameters. But of course, hugs is not distancing. And it's very challenging. I know that teachers love their children and children love their teachers, and that's a great thing. And that's why we want to think about what can we do that's in place of hugs this year. A lot of people are doing the distance elbow bump, those types of things. But certainly hugs, it may not be the time this year for hugs. It's hard to say.
Yeah, it's a natural thing when they're seeing, they haven't seen their teachers in all summer, and it's that reunited hug, like let's all get together and say, I'm so glad to see you again. We also know, but kids are dealing with a lot of stress. We know as adults, we're dealing with stress with COVID-19. Our kids are dealing with a lot of stress as well. What advice could you give to parents to ease the stress of their students, of their child, as they're going back into a building where they have all these rules and everything has changed?
Mm-hmm. I think, Danita, we think about that, but also importantly, we think about the stress that children are experiencing from their parents. And a lot of parents are losing jobs and have economic stress. And when a parent is stressed, a child is stressed. So there's the COVID stress, but there's also the general stress in the economy and in the country right now. And so what we do sometimes as parents is, if we don't know the answers, sometimes we don't want to ask the question. But what we want parents to do is talk to their children and open that conversation. Just opening the conversation, even if you don't have the answers, can be helpful. Just the act of talking can be helpful and make children feel more secure. And so open that conversation. Ask them, what do you know about COVID? What do you think about the masking? Do you think that you can go to school and really stay 6 feet away from people? Just opening that conversation and getting them to talk is helpful.
I agree. Laura Elizabeth has a point I want to bring out, and she's saying, why are we forcing kids to wear a mask if the CDC does not require children under 10 to wear them? Why not just give the teachers the N95s to wear? So if you could stress the importance of children and the teachers wearing the mask in regards to COVID-19.
So yes, that's a great question. And we know that children can spread COVID. And so we talk about masking. There's two aspects of masking. One is we wear a mask to help us from catching it. But also importantly, we wear a mask to help from spreading the disease, especially when we don't know that we have symptoms. Oftentimes we have symptoms, we're staying home, we're not out in the community. But before we have symptoms, we can also spread COVID. And so in the hospital, we call that source control, when you put on a mask, when you don't know that you have COVID, but you may have it. So it's important for children to wear a mask to help keep other children and teachers safe. And also I worry about all of the other people that are in the room. So it's teachers, but also people cleaning the room. So every person that's entering that child's room, we want to protect that classroom. So teachers, the administrators, everyone who's coming in. So that mask helps with source control.
Well, Benita McCullough has a question. What if your child has asthma or allergies? Should they wear a mask? And if not, what are some alternative things that parents can do?
So if your child has any pre-existing conditions, like asthma is one of them, or any other type of breathing issues, you would want to have a conversation with your pediatrician before they go back to school. So depending upon their asthma, they may wear a mask, or the pediatrician may recommend that they do not wear a mask. Some places are considering face shields. Children are wearing face shields, and so that's a possibility also if the children are not able to wear a mask.
Okay, here's another one. Andre Mercado. In my children's school, they talked about going to the bathroom in groups. Is that okay? I thought that it was supposed to be less amount of people. Shouldn't the bathrooms be sanitized in between?
So there should be some regular sanitation of bathrooms more this year than there was previously, but there aren't any recommendations right now that it's between every single use. But when we think about bathrooms, there are a few considerations. So that's a great question to think about that as a place where we should focus. And when we think about bathrooms, what we want to think about is lessening the amount of people in bathrooms. So if they do go in a group, to have them queue outside of the bathroom in a distance manner, and closing off every other stall, every other sink, so that you don't have as many people in the bathroom using it. So to decrease that density of people in there. But going and washing hands on a regular basis is certainly important.
Yeah, the washing hands, I have to say, we've been so focused on masks and social distancing that I feel like the washing of the hands, you don't hear that as much, but it is just as equally important.
Yes, and that's why we talk about those 4 layers. I really feel that those 4 layers are important. And so the cleaning, when we talk about cleaning, my own personal cleaning for an individual is the hand hygiene. And so not just when we feel like our hands are dirty, but at regular intervals this year to go and wash hands. And you see the graphic up there about how we wash the hands and wash all of the areas of the hands, use that, and importantly, taking the towel, that cloth or the paper towel that we use in the bathroom, and using that to turn off the faucet when we're done. So you can turn the faucet on without the towel, but turn the faucet on, wash your hands, and use that towel to turn it off and to open that door. Oftentimes school bathrooms do not have doors. They're kind of set up in a way for privacy, but without a door. But if there is a door on the school bathroom, to use that towel as well to open that door handle and throw it out on your way out.
And I believe a big message that needs to be sent to parents in this whole process as we are evolving and learning more and more about this every day because it's changing. The one message that parents must keep in mind, and that will hopefully help them keep their stress down.
Flexibility.
Yeah.
That this is a year of change. There's a lot new, and the schedule is just one of them. The new practices before you leave the house, the fact that your child may go to school and they may call you more frequently this year to say your child needs to go home. I wish we had one answer and one way to say, hey parents, this is what it's going to look like the 2020-21 school year, but we don't, unfortunately. So to be flexible and to talk to children about, this is the plan for August, this is the plan for September, and it may change over time, but we have to be flexible, which is very hard because one answer makes us feel safe, but there isn't one answer now. So flexibility, open conversations with your children frequently will help.
And I think that is keeping the conversation open. And even the conversation, what have you learned in trying to put this plan together, the restart? What are some things that you have to make sure that even teachers, school districts, that they have to keep in mind as students are coming back in?
So I think that flexibility for schools, but also the same thing that we're talking about between the parent and child, which is open, frequent communication. For the schools to be talking to their parents and their families and their children frequently and telling what they know, but also what they don't know. It's hard to admit, just like parents, it's hard to say when we don't know everything, but we're doing the best we can with the information and communicating with families frequently. So daily, weekly, so to communicate, even if you don't have the plan yet, to reach out and say, this is what we're doing, we're working hard to make it happen.
And that's what everyone's trying to do. We're trying to make this happen. And here's a question, Virginia Crum. She has a question about the virus being smaller than the holes in the mask because she's read many papers from doctors posted in medical journals that say homemade masks do nothing because the virus is smaller than the holes in the mask. And she wants to know if this is true.
So we do think that there is some of the virus that can be spread through the mask, but the mask certainly helps. So we talk about these 4 safety measures. None of them are perfect. The masks are not perfect. The cleaning is not perfect, and the distancing is not perfect. So none of these safety measures are perfect, but put together, when they're layered, they help.
The layering is better. And what about the N95 mask and irritation with masks? What
So
if
the
that
mask,
happens?
yes, the mask certainly can be irritating, and that's why being with your doctor and working with your doctor can help, but also trying on the different types of masks. And also, when possible, it's challenging, but is there a chance for a mask break? For teachers, we're certainly talking about, is there an area where you can go to? Because if they're in there for a long stretch of time, is there an area where you can go to, maybe outside, where you can get outside by yourself and take that mask off and have a mask break?
So we have another one comment. I'm nervous as a working parent. My kids need to go. This open communication would be me telling my kids that there are better ways to protect them than toxic cleaning products. So can you talk a little bit about, cleaning a mask and sanitizing, what type of toxic things that their parents obviously concerned about when it comes to their kids and the cleaning of masks and hands?
So the mask, when you come home from school, you can take that mask off. We have in our playbook how to take a mask off. You take it off between, the loops behind the ears, and you just wash it overnight in the washing machine with the same detergent that you use for your other clothes. So there shouldn't be toxic chemicals that are used to wash the mask.
Okay. All right. Well, Dr. Joan, I don't have any more questions. It seems like our viewers who are on this morning, I don't see anything that they are scrolling up. You hit the key points. Parents, you got to have a flexible mindset going into the school year. And we have to make sure that our kids feel comfortable to talk to us about COVID-19, their concerns and their fears. And just keep in mind that it's changing every day. We have to look into that, and we're all doing the best we can to make this happen and make our kids feel safe and also have a great learning environment at the same time. Big challenge, but we can do it. We can do it. So thank you so much for joining us this morning and taking time out of your day. We really appreciate it. And we're going to have more of these stories on News 5. So keep it right here on News 5 as we help you get your kids back to school safely. Dr. Joan Zoltankski, thank you so much from University Hospitals. We appreciate your information.
Thank you, Danita.
All right. Take care.